Thank you, good morning. I'm very scared about this gong. So my name's Cara, I'm from Griffith University in Queensland in Australia. We have First Nations populations in Australia. They are majority in dispersed or isolated or remote settings. Water and sanitation and energy provision is very, very below par. I would question that 4.6% in pathogens in those remote communities. A lot of the challenges relate to colonisation, disempowerment, poor community involvement. Everyone's nodding their heads. It's all probably quite similar to here. Some of the solutions are an increasing knowledge of how, where and when to involve community, i.e. budget for right at the start and ongoing and genuine consultation, but also more of the co-design as well. So our Indigenous populations are probably, well, they are the oldest and I think smartest water engineers and water managers in the world, certainly in Australia, and bringing their knowledge in from the start and talking in a language and an accessible way of involving them has starting to increase a bit more awareness on what are the drivers and the challenges, but also the solutions for safe sanitation and water. And the I Know We Know project is one of the projects I'm involved in that's looking for community involvement and digital tools to use what's there, to base the strengths of each community, place-based and co-design of community approaches for increased water knowledge, awareness, education. Thank you.
Celebratory ball. Well done.
All right, next up we have Drew Capone.
Good morning, everyone. I'm Drew Capone from Indiana University. Been there for about 3 years, moved there and learned very quickly about the combined sewer overflow issue in Indianapolis, Indiana. So for those who aren't familiar, we have separate sewer systems where the rainwater and the wastewater are in separate pipes like we have in Bloomington, where I live. In Indianapolis, it's an older system, so it's combined. So when it rains, all that stormwater is mixing with the sewage. It overwhelms the downstream wastewater treatment plant, has to go somewhere, and it's being discharged at all of those red dots there. So there's literally hundreds of combined sewer overflow points within Indianapolis, Indiana. All it takes is 6 millimeters of rain for an overflow to happen in Indianapolis. So that happens 45 to 90 times a year. There is a history of kind of like social justice in part of this. In the 80s, Indianapolis actually built a tunnel from the rich white part of the city in the north down to the black part in the southern part of the city because the rich white folks in the north didn't want overflows happening in their communities. Fast forward to the early 90s. In 1994, the EPA passed some guidance for combined sewer overflow control. And part of that 94 regulation was long-term control plans. So any municipality in the United States needs to come up with a long-term control plan, and that's a 15 to a 25-year plan on how these municipalities are going to address combined sewer overflows. So from 1994, it actually took Indianapolis 10 years to put together their overflow plan. And that construction started in 2005, roughly. And this year in December, they will finally complete the Dig Indy tunnel system. It's a bunch of tunnels 250 feet below the city where all that wastewater and stormwater can be stored temporarily until it can be treated downstream. So my group got some funding from mostly starting with my startup funds and then now from NIH. We're doing a trial to look at the impact of this combined sewer flow intervention on improvements in water quality and fecal contamination carried by flies, and then using QMRA to estimate health impacts on this. And some of my students are presenting some of the data on that this afternoon, so thanks.
Who's going to be brave enough to pass the 2-minute boundary? Oh, maybe me. All right. My name's Aaron Bivens. I'm an assistant professor at LSU. So we've been working on, for about the last 4 years, aerobic treatment units. So there's about 500,000 of these in Louisiana. Basically, the way they work is they're activated sludge miniaturized. So there's an aerator at the home. Most homeowners don't understand, what's going on in their backyard, and so they unplug the aerator, or the aerator's damaged. They're really never maintained. There's no enforcement or inspection after year 2, basically. And they discharge directly to ditches, as you can see in this picture here, right? So what we found is that about half of them are dysfunctional, meaning that the ditches are all, we've sampled in the ditches and they're, you know, in some cases equivalent to raw sewage. So, I mean, these are permanent combined sewer overflows in these peri-urban spaces where stormwater ditches are, you know, mixed with sewage. We've been looking into UV LED disinfection. Currently, if you're an individual homeowner in Louisiana, you have to have a contact chamber for chlorine, but you don't actually have to use it. It just has to be installed. So there's a lot of strange things in the policy. So our work has been funded primarily by EPA. We did a microbial source tracking project and found the local rivers were something like 1% sewage. And so then we said, okay, we got to go upstream. So now we're in the ditches and the discharges through the Lake Pontchartrain Basin Restoration Program, which is an EPA sub-program. The challenge we're facing is the proliferation of these failing systems, and the local government capacity just doesn't, they can't keep up with the development. What we're finding as a promising solution is actually linking the impacts of these systems to things people care about, which is mosquitoes. So these mosquitoes drive, or these ATUs, the sewage drives mosquito proliferation, especially the mosquitoes that transmit West Nile. People in Louisiana hate mosquitoes. So when they come out to the ditch and they're like, what are you doing in my ditch? I usually say, we're trying to learn how to kill mosquitoes. And they're like, yeah, kill them all. That would be great. So that's what we're finding is a useful avenue for us, is tapping into kind of the local issues that people care about and linking them very definitively with WaSH. No gong.
Here, wait, I'm doing the, yes, and I will got the timer myself, absolutely. Well done. So, and I am timing myself. My name is Leanne Kermitas. I'm from Virginia Tech. I am a professor in biological systems engineering, and I've been working in Central Appalachia now since 2010. And so I really love, well, I don't love, I hate, these pictures are myself and my student, we are collecting point of use drinking water. So including Kate Albee there at the top from that ditch, that is point of use drinking water. Both of these pictures were taken in McDowell County, West Virginia. McDowell County is the poorest county in the entire country. It has been that consistently now for 6 or 7 years. They were, in 2017, they had the lowest life expectancy in the United States for men and women. I believe now they have the second lowest life expectancy for men and women, so great job. I'm gonna actually, both of these are things I feel like other people have talked about, but since Joe challenged us to talk about funding, I will say funding has been a challenge for us. I'm gonna be the skunk at the party and say, we went for an environmental disparities grant, a really large one in 2013-ish. And we had high scores but weren't funded, and we went to NIEHS and said, you know, what wasn't interested? And I will never forget, the program officer literally went like this, there aren't health disparities for white people, and Appalachia is white. So I'm here to say two things. One, there are health disparities and poor people who are white, and two, Appalachia is not all white. So discrimination and poverty are complicated things. Right now, we're pretty fortunate. We do have some, so most of my entire career was robbing Peter to pay Paul. You were, Aaron, interested in mosquitoes. We had an early project interested in benthic macroinvertebrates and mining, and we linked in straight pipes to get money going. And now we have some foundation money. And I have 1 second left, so I'm good.
Awesome, thank you so much. All right, Jillian. I built in a lot of fluff, so we're gonna have a good discussion, hopefully.
Yeah, I'm kind of tempted to go long, just keep going so that you'll at least get to use it once.
Oh, I will. I wish we had a celebratory gong thing too, because everyone's doing such a great job.
Yeah. Well, good morning, everyone. I'm Jillian Maxey Brown, and I'm at Auburn University. We work primarily in the Black Belt region, so Joe gave you guys some preview into what we're talking about. This is the Black Belt region. Is it gonna work? Can you guys see it? Yeah. Okay, so that's the Black Belt region, all the red area. There's very few sewer systems in this region, so a lot of the houses are using septic system, but the red indicates areas that are not suitable for conventional septic. So you're gonna have to install a very expensive advanced septic system in that area. Now this is caused by the soil. So you can see in the bottom, whenever the soil is dry, it shrinks and becomes, there's vertical channels. It's called a vertisol soil. So you could potentially have the raw wastewater going directly into the groundwater depending on where the groundwater is. And then whenever the ground gets wet, like from a septic system, the clay swells and becomes basically impermeable. So we have a number of houses that are relying on failing septic systems or resorting to using straight pipes. And there's a lot of different organizations in Alabama and across the US that have been involved in the Black Belt issues. So we have formed what's called the Consortium for Rural Water and Wastewater Management in Alabama. And that is a collaborative effort between stakeholders across different fields. So we have people from academia, we have elected officials, we have the governor's office is there. We also have our government agencies for our health department and our environmental management department. There's a number of industry partners, community organizations, and then some other NGOs. Two of the big projects we have going on right now are developing a decentralized clustered system. So that's in the middle of the screen. It's hosted at Auburn University Rural Studio. So it's a different campus from main campus, but they're hosting this wastewater treatment system, which Olivia will talk a little bit about on the next set. And then there's also, oh, that one's a liquid only sewer. So it's a cheaper option than a traditional sewer, but will still get you the economies of scale for the whole community being served. And then there's an organization called BBUWP that is installing individual septic systems for houses. And these are advanced drip systems. So they cost about $28,000 a house. So we've had a lot of success getting that going, and the consortium's been really helpful for getting a lot of collaboration and momentum happening. And where we're kind of moving towards, I flopped and I'm putting my challenge at the end, is looking at how can we get reoccurring funding? Is there a way that we can get into state funding to be able to get this sustainable? And you're welcome. I had to do it for you. I had to make your day. Great job.
Hey, that's being efficient, you know? Take it all the way to the wire. I love that. Okay, let's see. Olivia, welcome up.
Hi, I'm Olivia. I'm a fourth-year PhD student at UNC. Thank you. Yes, I'm a PhD candidate at UNC. And I have been, as part of my research, I've been tasked with evaluating the cluster system that Julian described. And so I've been working in a small town in Hale County, which is a county in the Black Belt, where we've been doing microbial testing and pathogen tracing. So at 52 households, I collected soil samples, drinking water samples, and wastewater samples, as well as did 3 different interviews. So a demographic interview and kind of like introduction, a interview about the sanitation and drinking water infrastructure at their house, and then a well-being interview. I kept saying interview, but the correct word is survey. The well-being one was a survey interview type thing. And then with the Photo Voice project, that was kind of my passion project because I really wanted to elevate community voices. And so this is a qualitative method of research where you use community-led questions and community-taken photographs to kind of see an issue of the community's choice through their eyes. So that was really exciting. I think the promising solutions would be investment by the community in this and interest in this pilot system that is happening. And then pressing challenges would be awareness and belief, not only from academics and engineers, but also from other members of the Black Belt who might not have this issue specifically or might have access to sewerage and not really understand the issues with the soil, and then open communications from all parties in projects like this one. Yeah. Did I make it? Good.
I feel kind of bad about my turtle getting struck by lightning now, but
Yeah, I was really scared.
all right, I was there.
All right, good morning, everyone. My name is Alistair Cohen. I'm an assistant professor at Virginia Tech in Population Health Sciences. And so we're doing a number of things, but just to highlight the main projects that we're working on. The first, this is a new study. So there's an intervention trial providing lower income rural households on well and spring water with filters. And these filters have 2 components, a microfilter and an activated carbon unit. This trial is based on preliminary results from 2 pilot studies where we saw echoing findings from other groups, relatively high microbiological contamination in wells and especially in springs, and also evidence of infections with waterborne pathogens based on using biospecimens, saliva, and stool. And so that we're doing with a number of excellent collaborators at Virginia Tech, East Tennessee State University, UNC, and UC Berkeley, and hopefully EPA, but we'll see. The other big part of what we do as far as primary work is wastewater-based surveillance and EPI, but exclusively in rural settings. The big picture idea there is that we think there's much more benefit potentially for using this in rural settings where you have, all things being equal, poorer health surveillance infrastructure, less data on reportable diseases. And so there's a much stronger opportunity there to support public health agencies, but there are unique infrastructural challenges. And so we look a lot at pathogen signal loss due to inflow and infiltration, and trying to work with utilities to find cost-effective ways to use wastewater-based surveillance and extend it to EPI with collaboration with health departments. We also do a lot of fun secondary stuff too, looking at both the private side and the public side. And I think I'm good. Yeah, and I'll save the rest for the panel part. Yep.
Okay, Carmen is next.
So I'm connecting online. My name is Carmen Antoni, Associate Professor at the University of Twente in the Netherlands. And some of the work that we're currently doing is trying to make water and health insecurities in Europe visible. So with ongoing work with people experiencing homelessness in the context of heat and flooding, but also ethnic minority communities and how they experience environmental health risks. The present health challenge that we look at is particularly the inaccessibility of information and the resulting, I already mentioned, invisibility of those groups, and therefore also the difficulty in reaching those groups through targeted decisions and interventions. So, of course, this is also challenged by funding challenges as well. So the projects, and the one project that I'm presenting now, it's really low budget, very small seed fund, which we're currently trying to get bigger funding for. So how we're trying to address this, or what is the promising solution? I'm showing the example of a Roma community in Slovakia, a project which we're currently running, where we integrate methods rooted in different disciplines. So we combine social, geographical, medical, technological approaches and bring information from different levels, sources, perspectives together, including using satellite data to identify where are those marginalized settlements located, using drone to see from above waste collection sites, rivers, stray dogs that are heavily infested with parasites, etc. We also do household surveys, in-depth interviews, group discussions, and photo voice as well. So this was already nicely explained by Olivia what that entails. To use validated age-wise or sanitation-related quality of life scales, capture self-reported symptoms through syndromic surveillance, but also understand really through the perspective of the people living there, what are the challenges they're facing and how do they want to address them. We also co-create solutions, so we try to capture also with a number of different methods how could the problem be addressed? And another focus of the work is making or adjusting methods, so making them fit better to challenging contexts, considering that the population groups we're working with highly distrust research activities and authorities. So we're working on methodological adjustments too, and how to better reach them. So the value of this is really inter-transdisciplinary approaches. I forgot to say that we do parasitological work as well. So we analyze dog and human stool and soil and water samples too. And really out-of-the-box approaches to really make population groups that are left behind more visible for participation, for improved representation, public discourse, and improved decision-making. Thank you.
This is great. That means we can talk a whole lot. Okay, so what I've done here is kind of summarized a lot of the challenges that have been shown on these slides. And what I'm going to make you do is power rank them. I use the language, what's most pressing, but maybe what's more appropriate is what would you like to discuss? We're trying to kind of order topics for the panel discussion. So let me open this. Okay. Oh, I figured it out. I have to use the actual Slido slide. There we go. It should be active now. I was on the screenshot instead of the real deal. All right. I think we've got enough to work with here to get the conversation going. Just screen clip this. Thanks, everyone. Okay, so next is on the solution side. Make sure I've got the right Slido up. I think that's right. So promising solutions, and again, same thing, rank ordering for discussion. Is the poll open?
It appeared briefly and then it went away.
All right. Make sure. There we go. Should. What's that? Oh, let me move it. Yeah. Sorry. It's back. There we go. Driving two presentations simultaneously. Okay. I think we've got enough for a conversation. Okay. I think I've got enough clipped off the results to have inform our panel discussion. We're like 20 minutes ahead of schedule, which is great. That means we actually have time for discussion, which is the most important part. This is my more AI slop for you guys. Solar panels having a discussion. Yeah, I asked AI to make a funny picture of a panel discussion, and then I had to redirect it to make solar panels having a funny discussion. So we've also got so the way I want to do this, I want to go through challenges. We'll do the rank order, and then we'll do the open kind of word cloud from the beginning. And then we'll go to solutions. We'll do rank order, word cloud, and then there's also a generic Q&A where you can hopefully submit questions, comments, etc., and have a dialogue. So I'd like to invite the panelists up. Would you mind ringleading this a bit? I'm going to try to keep notes because this is probably the most interesting part. And obviously we've got the slides for everything so far. So it'll be to get a bit more organic now. And then you can submit Q&A here. Let me see if I can. Oh, there they are. All right, so these are the rank order, and then it follows. Let's see if we can find I don't know why it's not displaying here. That's the problem I'm having. Oh, yes, you can see on your phone. And then there's the slides here. So, okay, let's kick it off.
And thanks, Aaron. This technology is great, right? Beats sticky dots. Am I right? Yeah.
Yeah, I didn't want to fly an entire suitcase of sticky notes
Yeah.
up, so.
And I just want to say, please use Slido, but you can also do it the old-fashioned way, and you can raise your hand and ask questions
Yeah.
as well.
Yeah.
There's
Right.
no gong anymore. You all get unlimited time.
So I want to start by, asking our panel maybe to address the top one or two of these, and kind of briefly go through from your context, how you see these top 1, 2, or 3 challenges here, and how it fits with your context where you're working. Does it resonate? Is this? Yeah. So the floor is open.
Yes.
Yeah.
Okay. Yeah.
Yeah. So
So give us a little more flesh on that.
Oh, okay. All right. Yes, it does. No. So particularly invisibility of vulnerable groups. Again, in Australia, I mean, it's very complex, like it is here, probably. But that invisibility, in one way, it's got a lot better. But in another way, the government still needs to walk the talk. The policies are still invisible, if not the issues, which is a problem. Lack of local co-design, definitely. Trust training, leadership capacity. All of these things are often in a Western framework. That is not a First Nations framework. So it's just it's still not hitting the mark, and I think until those really basic issues get sorted, certainly in Australia, we're not going to quite get to that level of co-design, but we're working on it. And I did want to say, for people who are going to ask questions, the first 5 people are part of a co-design I did with some Torres Strait Islander folks, was a book about water savings. So you can have a book to encourage the first 5 people asking good questions. And yeah, a little bit of, yeah, that's right. Not just when's the lunch break and I have a book, but
You all want this
something
book.
more.
I stole
Yeah.
it. You should all have
Anyway, so that's me. Thank you.
I think one aspect of invisibility, right, is not just awareness of the issues, but actually I've been working with colleagues in public administration, public policy, and it's invisibility during policy processes, right? So communities are not being, their point of view, their experience is not being incorporated into the policy that then drives these things happening. And I haven't really seen that changing despite the increasing awareness, right? There's plenty of folks living in these peri-urban spaces in Louisiana that have almost no say, despite the increasing awareness, especially as we're bringing more data to the table of what's going on and how big of a challenge it is. So,
And frequently, like, there's just not official data on subgroups where you need it to be, right? And then, Carmen, can you hear us online? Do you want to say anything about that? Because Europe is one of those places where, in many countries, there's an official policy against collecting disaggregated data by ethnic minority status and so on.
Sure. So, of course, this is the core of my work these days. So I have a lot to say about invisibility of vulnerable groups. Absolutely agree with invisibility during policy processes or invisibilization. I don't know if the word exists by governments. For example, in Slovakia, where we work with ethnic minorities, really right-wing government that really does not want to serve or include or have participate said groups to improve their situation. And yes, so what you're saying, definitely a point I wanted to make as well. So I'm in Europe. I live in Europe. It's not allowed to collect racial data or information about race, about individuals. So making visible those challenges, for example, of Roma communities is very difficult. It's difficult because it's not allowed, or highlighting this group in statistics is not allowed. But also a lot of the data that would shed light on the challenges they're facing is actually collected not in English, but in local languages, and we have so many of those in Europe, and it's very difficult to have them, to have reports that might shed light on their situation represented in national statistics, census data, have them visible in JMP reports, etc. So I find it mind-blowing and shocking that in most of the countries we work in, there's 99 point whatever much coverage of safe water or sanitation, or better than basic. But then when you look at the situation or look at specific subgroups, you see, I don't know, 500,000 people experiencing homelessness in Germany, for example, where they lack safe access altogether. So, yeah, definitely a political issue too. Yeah.
Yeah, if I could ask, Alistair, you've been working on WaSH in prisons, which seems to be a particularly difficult population to get any kind of data about. Do you have anything to say about that?
Yeah, but if anyone wants to help me get funding for this, that'd be great, because we've been trying pretty hard for a few years. Yeah, so on that, so that's a project we've been doing. So the idea was just looking at Safe Drinking Water Act violations and comparing systems that serve prisons versus not. So we've actually done quite a bit of work in that space, and we should be getting a paper out. I'm looking at Almu. We should be getting a paper out sooner than later on that. I guess part of, I guess I wanted to comment on the vulnerable populations too in Central Appalachia, but they're actually linked, because there was a huge prison building boom in Central Appalachia that also coincides with a lot of environmental hazards. And a lot of these prisons were also built on former mining sites. And so we've had challenges there. One, it's a population for which it's really hard to get good outcome data. I tried to contact a few Department of Correction, the State Department of Correction offices in the area. And actually Virginia was one of the more kind of open or receptive to research and collaborating on research. But even in conversations with them, I had a proposal to NIH, and at the end they said, sorry, we are not in a position to provide you a letter of support. And they also said there are avenues to get health outcome data there, but really messy. You could go through FOIA, but better, I think, to try to have a collaborative way to do it rather than do it that way. So that's a big challenge. I'll just say part of the reason the focus there is for anyone connected to utility supply. Of course, you may drink the water, you may filter the water, you may drink other beverages, store-bought beverages. So just, we can't make too many assumptions about actual exposures just because you're connected to any given, public water system. The difference though with incarcerated populations is we can. And so in a previous publication, we looked at like commissary costs of bottled water and basically showed even at maximum employment, if somebody wanted to just use bottled water, that was almost impossible and incredibly unlikely. So that was the angle there. And short version, we did find a very significant association with the likelihood of violations for systems serving prisons versus not. The last thing I'll just add on the invisibility of vulnerable groups, this is something Leanne and I and others have discussed quite a bit, and also colleagues at ETSU. In Central Appalachia, a lot of the population is uninsured or underinsured or not connected to healthcare systems voluntarily. And so what little reportable disease data we have, we know it's underreporting the actual burden of disease. And that's still a big challenge, just to understand like what's the problem and where and for what subpopulations. So.
Thanks. We've had a really nice question that's resonated with me in the Q&A about politics. So several of these talks are from, and several of you are from the southeastern USA, which I wouldn't take to be a reflection of this being an especially problematic place. We have environmental justice issues all over the place, for sure. There are some specific issues from the southeast, but the question was, these are right-leaning areas politically. Does that contribute to the invisibility of groups, do you think? Explicitly? Yes. Any thoughts?
So Appalachia can be very problematic because there are a lot of assumptions. And I will say that, there's been attempts to raise awareness on social media and such, and lots of times I get, these people voted for Trump, they deserve it. And that's unhelpful. It's also unhelpful in building bridges, right? Because it's actually an argument early in my career. I mentioned that I managed to get money through a mining group that was interested in bugs in the streams, which enabled me to look at straight pipes, which I was actually interested in. I mean, not that the bugs aren't important, bugs just aren't my thing. But we did publish on bugs. And you all are shocked, bugs don't like mine effluent, they also don't like sewage. Bugs like clean water. But it was interesting because I presented at a mining conference where there were it was the most contentious, and it was in like 2012, conference I've ever been to, where there were a pro-coal, Friends of Coal group outside, and then there was a Save Our Mountains group fighting and police, and I was presenting. And the progressive media covering it was, oh, this is terrible, all these scientists, except they were like, Dr. Kermitas is up to something with these straight pipes. I think we can all agree that's a problem. And so I actually think that if we look for places of connection, it's very challenging and you have to be very humble. It was really difficult during the COVID pandemic because even though Virginia Tech is closer to West Virginia than most of Virginia, I had about a 6-month period where I couldn't work there because of the state rules. I couldn't leave the state to do research. And then going there and people weren't vaccinated and there were all these politics. But there are places we agree, right? And that's a nice inroad. And so it's a place for hope. You have to say, I have had students, I'm just challenging, I had some students deep in the thick of it. There are very upsetting things happening in the United States. And they said, I don't want to do this work. These people are poor, but I'm not going to go help someone with a Trump. And, there were some challenging things. Or people with a Confederate flag. I don't want to help them. They deserve it. And I feel like when we start getting to those value judgments, that's just profoundly unhelpful. But it was difficult, right? Because I had several young 20-somethings say, I don't believe these people deserve this. So.
If I could editorialize for just a minute.
Yeah.
I mean, in the United States, one of the headwinds we face in this kind of work is that when misfortune happens to somebody and when people have problems, we tend to blame them.
Yeah.
That's part of our culture. We think, that this is a land of opportunity and you can make your own reality.
Yep.
And that is usually not true, right? And it sort of, politics aside, that's something we do on the left and the right. We're very judgy people. Unfortunately, I mean, we're a nation founded by Puritans. What can we say? I mean, So this is a challenge. Thank you for that. We had an IRL question, if you'd like to go ahead, please. Yeah.
Hi, my name is Meryl with London School of Hygiene and Tropical Medicine. I'm just interested in the relationship between number 3, so awareness, belief in the problem, communication, and 4, so the consistent funding mechanisms. And I was wondering if you guys had any examples of where, through the work that you've done or through more communication and raising awareness of the problem, you've seen an uplift in funding, and yeah, some good news stories around that. If you have them, would be great, and also kind of the role of the researcher in those examples.
Book to you. No. Can I just?
Go ahead.
Oh, sorry, no, you
No,
go.
go ahead.
I've already talked.
So, yeah, so the question is about, you were asking about consistent awareness and belief in the problem, communication, and then consistent funding mechanisms to address those problems. And any thoughts on that? So I think I've kind of seen this in 2 different ways, right? I started off doing my PhD with Joe in Atlanta. I was a Peace Corps volunteer in Mozambique, came back, started dating someone who's now my wife, who was working with people experiencing homelessness, went to the park for a coffee, hang out, play board games on a Saturday morning, and was told the bathroom is the woods. And I was like, really? Like, and my wife was like, yeah, like, where else do people go? And that was really, and that led to a lot of work around people experiencing homelessness and better understanding sanitation access and realizing that open defecation was really common in Atlanta. And I think that was a very interesting experience because it was just, I don't think it was something that was really aware, like I was flabbergasted to realize that this was happening in my own backyard. And I think when I started talking to people, there was people who, like I met people in the street medicine community. These are like doctors who were going out and meeting with patients on the streets. This was not news to them, but for a lot of people, like that type of awareness, right, brought attention to that these things are not just happening in the streets of San Francisco, but this is a kind of across the United States. I don't know, and then funding with that is like that awareness brings a lot of attention, and I think there's been a growing conversation on the need for more public toilets and better sanitation access and understanding. I even saw a poster from a group at Georgia State that was just looking at our public accessibility of toilets, and that type of work can really bring awareness to these issues. And then kind of pivoting to Indiana, where I am now, it's a much different challenge, like with combined sewer overflows, where they passed this legislation in '94, and that was over 30 years ago, and they're finally coming to completion of projects in Indiana that were started 20 years ago. And it's been fun talking to kind of senior folks at Indiana Department of Environmental Management that were working there in the early 90s that EPA said, we need to do something about this. It took them 10 years to get places like Indianapolis on board to develop a long-term control plan. And that was 20 years in the making to kind of address these problems. And Indiana still has municipalities that haven't quite figured out their long-term plan 30 years later. There are still places, whether it's because they don't have the funding or the solution they thought isn't going to work. So this is still a challenge across the state. But because there is a federal kind of top-down, you need to do something about this, that at least it's regulated that municipalities need to be thinking about these issues and trying to come up with solutions. So,
I think Carmen has her hand up, and then Olivia. Yeah.
I wanted to speak to the same issue. But I'll just start where I think Drew ended. I think a big part, although this is, I guess, already part of the solution too, big part of our work as scientists working with such communities should actually be communication, and not just science communication, in my opinion, not just scientific communication, but science communication too. So in our work with people experiencing homelessness in Germany, where also open defecation was a huge problem, not just open defecation, but also fees related to that. So someone defecating in the open, getting a fee of 35 euros, which they might not be able to pay, or by the time it reaches them, it might have doubled, quadrupled, whatever. People might be unable to pay it, end up in prison because they cannot pay it, because the debts pile up, etc. Anyways, talking about these issues and putting them not only in a science paper or a scientific paper, but putting them in a newspaper, on radio channels, like in newspapers for people experiencing homelessness, and social workers papers, which, okay, it doesn't get us any impact factor as scientists, but really gets the word out and awareness across the broad public and decision makers too, can really go a long way. So I think it's really important, again, sorry, talking maybe about solutions already, but using also our amplifying voice as scientists to put a little bit of pressure on those decision makers that can actually change the situation. Because in our specific case, or in our specific case study and study area, actually the municipality decided they can find funding somewhere for additional public toilets free of charge and for additional drinking water fountains for people experiencing homelessness to use. So just wanted to say that might not be consistent funding mechanisms, but I think we can really use very well communication and our, say, objective perspective on things to improve the situation, or to get funding from somewhere, or to get those who should change the situation to fund an improvement.
Thank you. Olivia, you had something to say?
Yeah, I think Carmen spoke basically what I was going to say about how I think that in academic spaces and in places like this, it can be really great for communication and awareness on the funding side of things. But I also want to stress the importance of communication at the community level, and not only from researchers. So for example, for my project, it's about I've been trying to communicate about like the health risks, but I've been getting a lot of questions about the implementation of the project, about the engineered system and how it's going to get rolled out. And so I think that it's important not only for researchers to be communicating with the community, but at every level of the process.
Thank you.
I think Kara had something.
Yeah, please. Yep.
Just a good news story in terms of the funding for the Indigenous water management in Australia. Academics decided, well, let's not just write a paper, let's talk to state government and the service providers and Indigenous organisations, and we kind of got a glossy report together which really ties together the idea of speaking to the media or getting it out there, advocating for that. And that report got a lot of press. It then got announced that there was about $150 million to go directly toward Indigenous infrastructure in Australia. Now, it was only technology, and I've got a thing about technology being this much of the problem and everything else being a lot more of the problem, but still, that was a good news story that the advocation of the issues and the states working together with academia and so on and putting out a report, and then the politics got hold of it. And look, yes, it was politics. It was a kind of a sexy thing to put money toward, but it worked, and it's just starting to gain more and more momentum. All we've got to do is fund the non-technical issues, but that's another story.
Thank you. I want to pivot a little bit now. We'll get back to some of the questions about the challenges, but I think just as an indictment of the academic community, I think we're far too focused usually on the grievances and less focused on the solutions. And I think that's an area where, Leanne, you're talking about finding that common ground with people. I feel like it's often way better to lead with solutions, and if we can put more of our attention on that side of the ledger, I think that will do us a lot of favors in terms of making progress on these issues. Which, I'm sorry, that's an obvious point. But I say that to say I'd like to pivot to some of the solutions and maybe get some further questions. We can come back. We've got a lot of great questions online, and we'll come back to some of those. But I'm wondering if we can move in that direction with the discussion, please. So does anybody want to start out with a hopeful story from your problem space that you'd like to share? Or at least something that you think is...
I think I'll say a bit more about the mosquitoes, right? Because we've had a lot of luck with that. Basically, there's several publications out of Atlanta where they were remediating combined sewer overflows, and they found that, hey, we get all this ammonia out of the water, and the mosquito proliferation, their time to maturity, the numbers decrease, they're lower. And so we've got world-class mosquito abatement districts in Louisiana. A lot of the people at the CDC that work on mosquitoes come from Louisiana. They're excellent at their jobs. They're well-funded because people hate mosquitoes. And so what we found is, okay, this sewage effluent, right, there's ammonia in it. There's a fish called the mosquito fish that eats mosquito larvae. They give live birth, and so they're pioneering fish. They can survive at really low DO levels. And so they pioneer into these ditches and chomp on mosquitoes. However, ammonia is toxic for them. So when you have failing aeration, you get a lot of ammonia in your effluent. It pushes those mosquito fish out. simultaneously, the mosquitoes want the nutrients. They're attracted to the scatol. And so it's this crazy system where sewage exacerbates mosquitoes. And so we've started making kind of preliminarily that linkage. Now we're trying to build out quantitatively. And what we found is in the parish, in St. Tammany Parish, there's about 36,000 ATUs. It's the highest number in the state. They have an excellent mosquito abatement district. And the mosquito abatement district has come forward and said, we will fund an ATU inspection and enforcement program because we spend so much money larviciding 600 miles of ditches that it's a cost savings for us if we address this issue. So let's see what unfolds, right? It's early, but we're getting a lot of traction around that, and it's something I would have never arrived at except having, lived in Louisiana. So
I actually have a good story and the authentic sustained co-design. I showed those pictures of people collecting water from roadside springs. And I have an early colleague who sadly passed away in 2018 who said, the greatest trick to public health is always to meet the community where they are and start where they are, not where you think they should be. And, roadside springs fill a need. I have some research showing that often that water quality is not great, but is better than what's available in home. And this is not led by Virginia Tech, but there's a group in University of Tennessee that actually co-developed. They took a roadside spring where people were hauling water in Kentucky, and so there was high trust in this water, and it was also kind of culturally significant in a community gathering space. And they put in some very light treatment to ensure that that water at least met microbiological and primary guidelines. And then we're selling it, but for pennies on the gallon, right? So people often would come collect cisterns, to fill their cisterns at home or even to and it was a very, very low cost. And it was also connected to a church, and it had become like a mini farmer's market or gathering space. And so it was funny. I did some work actually with UNC where we were looking at investigating promising solutions in Appalachia. And the Appalachian Regional Commission was at first like, this sounds like a third world solution. But then when they saw the data and heard from the community and heard from other folks, they were like, wow, this is really amazing because it revitalized the community. People were getting safe water, and it built upon the existing strength and trust. So, yeah, very, very good. I hope we can do that in Virginia sometime.
Jillian, you've talked about the consortium that was established in Alabama. I mean, I'm a big believer in collaborations, and what's been the approach there with creating that consortium, and has it resulted in positive momentum that has affected people positively, or is it sort of just more meetings?
It is not more meetings.
Okay.
We need more meetings for that group,
All right.
actually.
Good.
The leader is not in the room. He's in a different side event, so I can tell him that he needs more meetings. I would say the consortium has been fantastic. I feel like when y'all were talking about the problems, we have problems in Alabama, but we've been having so many successes and solutions. I agree. Technical, it's very small, it's the bigger issue. But we have elected people who are coming to the table and are engaged. And so we've had good funding from USDA. Sherry Bradley, who leads the BBUWP, she was at the health department. She basically single-handedly applied for a USDA grant, got over $1 million, I think, right? And has basically created this nonprofit to work in the space where we needed help because academics can't come in the same way that a community organization can. And then we've come in with the cluster system. But being able to have all these different approaches and everybody engaged has been really big. And talked about the political issues. Well, our health department, there's the person who has taken Sherry's role. He is just as interested and just as open to it and has been helpful with making sure there's regulatory changes that make the systems more cost effective and more approachable to the context and not what the regulations were created for as like a blanket solution. So I don't have very much to complain about right now because I feel incredibly blessed that the people are interested and they do want to talk about it. And like our professional association for septic installers, they're at the table too. They are helping process all the applications for the community organization. And they are, like all the installers are signing up. They want to help. They want to be installing these systems. And it's a matter of the funding continuing and making sure that people are able to be engaged, because some of the installers have been getting turned away. Like, we don't have any more systems to install, and we don't want them to lose interest at that point.
Jillian, you've put your finger on something really important, which also a few other people have mentioned, and Christine Stauber has raised it in the Q&A, which is about kind of what academics can do, because this is a panel of academics, right? I think we're all academics.
I call myself a pracademic, but you're right.
And some of us are junior academics, and some of us are more senior. And there's a lot of potential areas of conflict between what we do in academia and this. And this kind of work is often not incentivized in the academy and so on. But does anybody want to offer any thoughts on that and sort of how we can be good allies as researchers, as people who are not going to go out and install somebody's toilet? Let's be honest. Maybe Aaron will, I'm not sure, but yeah, please, Alistair.
Well, I think I could address that and also maybe share a couple like vignettes of things that are working out and we see, positive impacts on the work. I mean, to that point, with so much of our work with communities is working with communities, meeting where there are, finding through great collaborators, finding nonprofit groups that have already built relationships, working with them, having them understand what we're looking at, why, and then if they think it's worth doing, them facilitating kind of outreach and collaboration. So that's been really, key to our success there. And then I'd say as far as that question of kind of academics, so a couple quick little things that I'll share there. One, so we work with a number of utilities in far southwest Virginia, both water and wastewater. One of the first projects that I did was really simple. It was hard to publish because it was a really small N, but it was really helpful for the utilities. So they wanted to expand water supply to a cluster of homes on well water. We talked about what we could potentially do, so we did a very quick, we thought it was going to be a cross-sectional study or a cohort study. It ended up just being a cross-sectional study, but just kind of relatively simple for us just to kind of get samples and basically make the point. We analyzed the data, put a quick report together for them showing, yeah, there's a lot of contamination in the well water in this cluster of households. Now, I'm not saying that got them over the top and got them the additional funding, but it certainly helped when they were putting in their proposals to get that, to fill in the gaps in their funding, to make the case like, look, there are real health risks here for this community. So that felt really good. That was a nice win. And then, a year and a half later, our paper comes out, right? Similarly, on the wastewater surveillance side, a kind of recent win for us is one of our projects. We're looking at hepatitis A and C, and we have our research interests for doing that. These are, fortunately, relatively rare outcomes. There's evidence that they're, more impacted as far as by dilution of wastewater and other factors, so harder to detect. And so we compiled our findings from about 6 months and then met with the epidemiologist at the local health district who we've been talking to since we started, so they're in the loop on this. And we basically showed them for this community, we're seeing hepatitis C. We're not always seeing it at the wastewater treatment plant influent, but we are seeing it up sewer. And so we're seeing, false negatives at the treatment plant. And that's more interesting for us on the research side, more broadly what we're doing. But we were able to show them, look, we're seeing Hep A at these sites in this sewer shed at multiple times. And for them, for us, this was like such a big win because they said, we knew about Hep C, we weren't screening for Hep A, thanks so much, we're gonna, look to start doing that. So that felt like just such a win, because again, it'll be, a year until that paper's out. So that's something we try to do is like with the partners we're working with, even if the data's not perfect, it's not replicated, just to give them a sense of what we're looking at, sooner than later. Oh, you talk about it. You're leading the ACTAT thing.
No, you talk about that. No, we share hive mind.
Okay, we have a fight breaking out on the panel here. Maintain decorum. Order.
I just want to say, as an early career faculty member, I feel like one thing in my own kind of day-to-day, right, is like pushing against the busyness, right? There's an all-consuming busyness about academia that's actually not that important. It's self-important, but I think that we have to kind of look within ourselves and our values and say, how can I align my academic work with my values work? And sometimes that doesn't show up on a CV. And I'll give you an example, right? I go and speak at the Louisiana Wastewater Trainers Association. I share our work on ATUs. I share our work on wastewater-based epidemiology. It's an hour drive one way to the venue. It's in the middle of nowhere, Louisiana. 40 wastewater people show up, and I just share what we're doing. And it's really interesting because these are, going back to the politics, these are deeply red conservative spaces. And then you come in and tell the story of how wastewater surveillance benefits communities, and it's not like a tinfoil hat thing. And you slowly erode and gain trust and credibility, and then eventually that unlocks entirely new things. But you kind of have to be willing to put aside or take the risk on the busyness side of things. So that's, I mean, that's my own experience, but that's what I think resonates.
So just to link in to finish up, because this is perfect. So Alistair and I also have some work with a consortium. It's University of Tennessee, University of Kentucky, West Virginia University, and Virginia Tech. And we do actual technical assistance and training for water and wastewater utilities. And, you know, that is not something that academically we get a lot of credit for. So especially, I wanted Alistair to talk about it because he was willing to jump on it as an assistant professor. I started as an associate where I had some more, you know, tenure, gave me stuff. But it's a great opportunity. It means we drive 3 or 4 hours into a deeply red district and spend a day training water and wastewater operators on something very basic for us, right? That is not scientifically interesting, but is really important for them. And long term, if you're gonna build authentic community relationships, that's what you have to do. Our first training in Lee County, I will always remember, because at the end, one of the they were pretty skeptical when we got there. Like, okay, you fancy university types. At the end, the guy goes, you know, I'm not gonna lie, I wouldn't come if I wasn't required, but this was the least worst one I've ever been to. And we were like, and I was like, thanks, man. You know, and I'm always the only woman in the room. And I was like, thanks. And then his supervisor came over and was like, girl, that was some high praise. But now those utilities are the ones that Alistair is using to do this really important fundamental work. But they were very, you know, they're going to be skeptical until you actually show up and do something that doesn't seem immediate. Yeah. And also through that, we have a Department of Labor grant with West Virginia University where we're actually hiring high schoolers to do internships as water and wastewater interns over the summer. Yeah.
Thanks. Just a very quick thing to mention. So I really appreciate you mentioning that because I hadn't thought about it in that context. But yeah, there's no academic output there for that work we're doing, and it is quite time consuming. But I'll say, Leanne and I joke, and we almost now tell them when we're doing these, so they get continuing education credits, you know, so and we
they're required to have from the state. Yeah.
And we know enough to make sure we cater from, you know, the best restaurant in town. So that's always a plus.
Which sometimes is a gas station. Remember that one?
Oh yeah. But I was just going to add to that. Leanne and I joke, and we tell them this too. Like, we feel like we learn much more from them than they learn from us, and I feel like that's every time. So I think,
and it's authentic.
I look forward to it's just such a treat to like talk to utility staff, see what problems they're dealing with, and it gives us ideas for like other projects. And again, with the idea of how can we find ways where there's a research question, but we can help you to address something like practical that you're dealing with and that you don't maybe have the bandwidth or capacity or support to otherwise look at. So, I mean, that's kind of the win-win if we can find it. Yeah.
I want to make one quick point. I know we probably have to move on. But what I'm hearing, hearing Aaron talking, you guys, like, and the importance of being community and the work that we're doing and that allows us by being friends with these people and having conversations, right? A lot of these problems are rooted in poverty. And that by being in community, it's like, how do we do this work without further marginalizing the people we're trying to serve? And that, like, that takes a lot of nuance. It takes a lot of understanding. It's when you're then publishing this work, what data are we anonymizing, or how are we framing it in such a way that we're not adding to the further marginalization of these communities? We've had these conversations and done this work with the United States. I do work in Mozambique, and my colleagues in Mozambique are often concerned about the same things. It's like with some of this data that, you know, how are we going to present it in such a way, and who are we going to share this data with to make sure we're not further marginalizing and impacting the people's lives that we're trying to improve.
We're getting into the cross-cultural work that is inherently involved in this kind of stuff, and that can be in the U.S. Even going into a place that's very politically different can be a totally different cultural context, right? And some of us are working closer to our cultural roots than others, and I wonder if I could call on you, Cara, to reflect maybe a little bit about how we do sensitive work with cultures that might be quite different. And that came up in some of the online questions as well, and native water rights were brought up, which is a big thing with indigenous communities in the United States. Yeah.
Thanks, Joe.
Comments?
Yeah, certainly water rights in Australia for Indigenous water rights are still being highly contested, and again making some headway. I'm a non-Indigenous person, so I shouldn't really speak on behalf of Indigenous people, but just give my reflections. So water rights are an issue. Water was never ceded, land was never ceded, typical in that colonised context. Working with Indigenous communities in Australia is really, really tricky. And there's some of my Indigenous colleagues say you have 2 ears and 2 eyes and 1 mouth. Listen, look, and shut up. And particularly with academics. And so I think one of the things, getting back to what you said before about how academics can help to support better WaSH outcomes, ask the community, how can we help you? Use those ears and those eyes and really just, and leave the ego at the door. And I think you mentioned that, Aaron, in a way, is just to, don't worry about what papers you're going to get. I mean, this is my most closest to heart output, and it's not going to hit an H index. So yeah, just that's where we've really just gone in, and it's expensive as well, because remote, and I guess in America too, it's so expensive doing remote Indigenous work, but you have to budget for time, budget for relationship building, budget for just, you might not get the data you need or in the first 2 or 3 visits, but eventually listening, storytelling, relationship building, yarning, those sort of methods are quite different, and there's a lot that I've learned over the decade or so that I've been working in this space, and it's rewarding, but it's really hard, and yeah, it's slow.
It probably makes you a
yeah.
better person to decenter yourself and be humble.
Oh, I think so. And I was joking before with the pracademic bit, but sort of not really. It's this tension. You've got to get your paper outputs, and you've got to win your grants, and you've got to have PhD students completions, etc., etc. But the work you really want to do with your heart, and your values and your ethics are aligning. It's that constant balance to get it right. Always learning.
My wife's a teacher, and her motto is survive and subvert. Do what you got to do to survive in the system, and then do the work you want to do.
Yeah. Nice.
The floor is open for questions out here. Yes.
Hello. Thank you all so much for being here. So my question is prompted in part by Drew with the Dig Indy tunnels in Indianapolis. I work with the DC Mayor's office, where we are unveiling our big tunnels in the Potomac and Constitute Rivers to deal with CSO events. And it is just humbling to see what an enormous decades-long undertaking that has been. I come from Kentucky, though, and so I'm wondering on the question of solutions related to scalability and transferability. A place is not necessarily as well-funded as DC is cosmopolitan, with such a huge utility like DC Water. What lessons or tactics could be transferred over to those places with something that would need such a prolonged involvement?
And I think that's the beauty of the regulation that was passed in '94, is that they don't tell the municipalities what to do. They just tell them you need to come up with a plan to solve the problem based off your local context and your financial situation. And that, like in Indiana Department of Environmental Management, their CSO, their kind of sewage and overflow staff are working with municipalities to help them come up with a plan that meets their budget and their timeline. So in some places, in Indianapolis, that's a $3 billion tunnel system. In other places, it might. They're exploring, if we have a combined system, what's the cost to put in a separate system? Or do we just need to expand the capacity of our wastewater treatment plant to be able to handle these rainfall events? So there's lots of different solutions. Some places it's easier in places with larger populations that have funding or have opportunity to write the grants to then fund that infrastructure. But I think that's the beauty of the way it was done, is that they're not telling them what to do. They're just telling them you have to do something. You have to make a plan to do something, and there's support at a state level to help them figure out what can we do given our context and our budget.
I have a question for Carmen, because she
You getting that, Carmen?
The last part of the question I didn't hear. She's
Yeah.
wondering what the last part I didn't get. The last sentence.
Please, she's going to use the microphone.
Thank you.
Co-design of solutions.
Yeah.
Hi, Carmen.
Hi.
I was just, from your presentation, and you were talking about co-designing with the communities, but also using very transdisciplinary methods in your research. So I was just like hoping to hear your input on those items 2 and 3 on the slides.
Thank you. Yeah, I was actually raising my hand a couple of times, but my colleagues covered a lot of the ground that I wanted to cover as well. Well, I think the kind of work we do, it's always collaborations between research, policy, and practice in some way. And we always start with what are the community needs. So we heard that from colleagues as well. And it's always, I mean, it's very difficult to convince a funder to do that. But we try to define our research questions as little as possible and usually include questions related to what is it that is the challenge that the communities are facing, to make sure that whatever we will do research on really reflects what are the needs of the community. So already starting to co-design questions. And then, yeah, I think I mentioned very briefly that a large part of how we do our research is trying to find the best methods to actually reflect challenges that our communities, our collaborating communities are facing. We involve and we train community members as co-researchers. We collaborate with civil society representatives or NGOs who act on their behalf or who serve them. And also we collaborate or try to collaborate very early on already with municipalities. Often it only, well, collaborations with decision makers happen at a later stage when they realize what kind of data and findings we generated. But we, yeah, we try from the very start. No, we don't try, but we definitely from the very start, we work with communities on what are their challenges and what do they find needs to be prioritized. And then we see what is the best way to reflect that. And then have municipalities be part of the process too. We try also to have them incorporated as co-researchers as well where possible. We try, or we don't try, but we give whatever is the result of our study. For example, in Slovakia, we have risk maps, integrated risk maps on where's what kind of challenge, where do citizens see environmental health challenges, but also, so what do they see through their perspective, through the photo voice, match that geolocation with what we see with the drones and with the maps that we create, hand that to decision makers, and then foster dialogue between, which is also usually part of the research, between citizens of those marginalized groups and decision makers on what to do with this information now. We collaborate also with small enterprises and businesses, or for example, swimming pools or vendors. So, for example, to have refill stations or to just make it very, very easy to have solutions that, in another study, for example, people experiencing homelessness propose as very low cost, very actionable, very easy, very acceptable for them to realize them. So it's working at different levels, but trying to make sure to always start with with the local and contextualized and marginalized problem, and the buy-in of decision makers. I don't know if that answers your question. And then we get very creative and out of the box in how we try to address this.
Thank you, Carmen. Thank you. I'm going to minimize your screen, but not you.
Yeah.
Can it be really quick? Really quick.
I think there's a difference between media and activism. I think that you have to include activists, but I will say that people who are activists can be tricky. And so I think communicating with certainly connecting people with technical assistance providers. You know, we work a lot with Rural Community Assistance Project and connecting people. But yeah, we probably should talk more to the media. But I feel like I love your story about how you actually like promoted it. I worry about straying into activism. I think that you have to maintain some objectivity. And I totally imagine others of you feel differently, or it's just nuanced.
So unfortunately, we'll have to stop, but I have like 3 quick things. One is the Spotlight Speaker Series, which is after lunch, is Transformational WaSH Leadership in Frontline U.S. Communities. It's going to be a great session. We've got a mayor of a small town, Mayor Braxton, who's here, Christy Pullen-Fedenik, and it's moderated by Tanvi Nagpal. It's going to be awesome, seriously. We've been working for months on this panel. It's great. The other, number 2, please look at this QR code thing. In Slido, you can provide your name and email. It'd be great to keep this community together a little bit and to keep the conversation going. If anybody's interested in getting, hopefully not annoying emails, but to carry forward this conversation, please do that. And then finally, let's please thank our panel. Thank you so much. Enjoy the coffee break.
Here, people who ask questions.
Embarrass myself if that means I don't want to be in love with a little book.
I'm going to cite you. I'm going to cite you. So
Go and sign.
I think it needs to be added to your Google Scholar, and we'll all sign it.
Yeah, all right.
What's the child? It's R21. Okay. So they're just reflecting water upstream and downstream of overflow points on 3 streams. So we're doing this year.
Thanks for all the tech and organizing.
Oh, no, that's great.
Okay. And then I've students that catch our flies near the mines overflows and like control sites.
I'm more
It's 28 miles of tunnels.
Oh, okay, I see. So you're like basically taking advantage of like a national service.
They're just there's like 2 of the large tunnels are going to go live.
Has Mark told you about
That would be, yeah, what a great opportunity.
I wrote an R01 to do like a trial. But I like didn't have a preliminary data on the human population. So like I came.
Families.
I was like, all right, I'll just find out and just
Aw, because it was one of your kids. I'm happy.
Is that for emotional support?
But that's actually very hard.
That's our childhood prison stuff. I tried to get funded.
I do that some. Yeah. Yeah, we have one Woofy. It's a puppet, and he goes around the world with us. Yeah.
Under a different administration, so it's not funded. So I'm going to resubmit it, which is probably worth the time. But yeah.
I do know that. Yeah.
CJ, you said you're from
DC, Kentucky.
Oh, Kentucky. Okay. And now,
Mayor's office in DC. So, yes, thank you for hearing my question. Just the Clean Rivers project there has been like on everybody's mind for a while. And I got to see what Indiana thinks too. Ask about that. I'm also trying to. I'm a weird case. I'm a former USA. I just got spat out of there by those.
okay.
So I'm trying to turn a path to graduate school. My background is biology. I'm trying to get CSO, seawater. Y'all are doing.
Yeah.
Feels like really, really something to take into.
Do you have a master's degree?
I do not. That's what I'm probably a professional master's. You know, I thought straight to a PhD.
It's kind of,
You know, rather than grad school.
Yeah, I mean, if you're interested in talking about grad school, I'm not going to check.
I remember that sounds almost like what the West Alabama thing should have been. And I remember like trying to connect with them a long time ago, and it was like basically there was no there, you know. It was like, so that's great you're doing that.
Yeah, I love it because they were like, I've heard of it.
Former USA and former
What were you doing at USAID?
So I was the assistant director of security.
Okay.
So I found a foot in the door doing that. And I thought of going there, rescue bureau that does the water resource work. I was not supported by a 100% fellowship that took me to Nepal for a little bit. To scratch my initial launch. So I thought that's what I was going to be doing. But maybe that's way somewhere you could build.
Okay.
Yeah, like, are you looking for like funded master's programs? Is that the goal? Trying to go somewhere?
It's starting to seem like maybe that's unrealistic. I'm thinking like maybe a professional master's and then like try to work in DC water, for example. And maybe if a PhD makes sense.
That's great.
Go back for that.
Because like